Thank you very much.
Thank you.
Could we hear from Kristen Westmoreland?
Good evening. Thank you for hearing my testimony. My name is Kristen Westmoreland. I'm an MD and I have a Master of Public Health from Brown, and I'm against H555 and 5865 and in favor of H5551. Forgive me, I'm going to read. It's too late for me to do this off the cuff. The medical marijuana program has just this year had its regulations changed, and I would not be in favor of increasing the number of distribution centers until we see some data that shows that this is necessary. And in fact, according to the DBR regulation officials, if the DOH regulations do what they should over the next 2 years, we may actually see a drop in medical marijuana card holders, in which case more distribution centers would be unnecessary. In regards to legalization, we currently have 2 drugs that are taxed and regulated for recreational use, and both alcohol and tobacco have huge costs that far outweigh the revenues that they generate in taxes. These costs affect the workplace, our roads, law enforcement, healthcare, and schools. You've heard from other testimonies about this. And despite having regulatory structures in place, both have illegal uses and black markets, and many of the other programs we are told that this legislation will solve in regards to marijuana. In addition, preliminary research shows that marijuana may actually prime the brain for opiate use. Emerging research is also looking at the issues around polydrug use, because it's not generally the case that people choose only one drug to use or substitute one for the other. And research has yet to study the effects of marijuana with THC content as high as 90%, which is found in some of our marijuana products today, which is likely going to be far worse than the 1 to 3% product that has been studied. In Rhode Island, we currently have very little infrastructure in place to collect the data necessary to establish even a baseline for the state in regards to the current marijuana situation. There is, however, abundant long-term data that shows that the best thing that can be done to decrease youth use of any substance is to limit access. Relying on basically the same regulatory and enforcement structure and funding we have for alcohol and tobacco, which tasks retailers and manufacturers with controlling sales to youth and others, is like asking a 3-year-old to limit how many cookies he and his friends can have when left alone with a plate of warm Toll House cookies. Edibles and electronic cigarettes will make limiting access to youth a tremendous challenge, given that we're already seeing problems with these products in our schools. We have had some success with lowering tobacco use rates, but remember, it's not the regulatory structure that drastically reduced the use of tobacco in this country. It was litigation, and it was litigation that resulted from tobacco companies lying about the health effects and costs of tobacco. It's only with huge sums of money and large public health campaigns that we have experienced some success in lowering rates of tobacco use. Public health campaigns and strategies to treat and prevent the costs associated with drugs in Rhode Island are inadequately funded at this time. Most of the funding has been eliminated from the state budget in recent years, and funds that were promised to prevention and treatment in the past have all been swallowed up by the general fund. And we know that the risk of addiction is much higher when people start using marijuana at a younger age. For youth, as many as 40% of marijuana users will battle addiction, and this is why Big Tobacco, despite regulation, continues to market to our youth, and Big Marijuana will be no different. Legalizing marijuana will result in high use in adults and youth, big business interests akin to the alcohol and tobacco industries, and is not supported by public health or most of the medical community that will be responsible for responding to these costs, yet will not be provided with adequate funding to do so. In addition, there is currently very little baseline data being collected in Rhode Island, so we won't even be able to track what happens. If you legalize marijuana this year without having baseline data, which can take years to establish and collect, granted, and we see opiate overdoses continue to rise, will you be able to have any data to prove that you didn't contribute to that? Thank you.
Any questions for the doctor? Thank you.